In the vast universe of microorganisms, there exists a microscopic entity known as SARS-CoV-2. This virus, invisible to the naked eye, is the culprit behind the global pandemic we know as COVID-19. SARS-CoV-2 demands our understanding and respect. Encased within a protective envelope, its genetic material holds the blueprint for its own replication. This blueprint hijacks the cell's machinery, transforming it into a factory for producing more viruses. The true danger of SARS-CoV-2 lies in its ability to spread. The virus travels through tiny droplets expelled when an infected person coughs or sneezes. Understanding the enemy is the first step in any battle. By comprehending SARS-CoV-2, we equip ourselves to combat its spread. Only through scientific understanding can we develop effective strategies for prevention and treatment. The human body, a marvel of biological complexity, is vulnerable to the SARS-CoV-2 virus. This intruder enters through our respiratory system, exploiting pathways designed to sustain life. Imagine a vast network of airways branching out like a labyrinth within our lungs. Here, the virus launches its attack. Equipped with spike proteins, the virus latches onto cell receptors. It fuses with the cell membrane, injecting its genetic material. This material takes over the cell's machinery, making countless virus copies. These new viruses burst forth, spreading to neighboring cells, repeating the cycle of infection. The body becomes a battleground against COVID-19. The human immune system, a complex network of cells and proteins, is our primary defense against disease. It is a vigilant guardian, constantly patrolling for and neutralizing threats. However, in the case of COVID-19, this protective force can sometimes become overzealous, causing more harm than good. Picture a well-trained army ready to defend its territory. Upon encountering the SARS-CoV-2 virus, the immune system springs into action, deploying its troops to fight the invader. However, in some individuals, this response becomes excessive, leading to a phenomenon known as a cytokine storm. Cytokines are signaling molecules that orchestrate the immune response. During a cytokine storm, these signals become amplified, leading to a massive influx of immune cells to the site of infection. This overabundance of immune activity, rather than quelling the virus, can trigger widespread inflammation and damage to healthy tissues. The lungs, the primary battleground in the fight against COVID-19, are particularly vulnerable to this collateral damage. The excessive inflammation can lead to fluid buildup in the air sacs, making it difficult to breathe. In severe cases, this can progress to acute respiratory distress syndrome, a life-threatening condition requiring mechanical ventilation. Section 4, the face of the storm: symptoms and complications of COVID-19. The clinical presentation of COVID-19 is as varied as the stars in the cosmos, ranging from mild flu-like symptoms to severe life-threatening complications. Some individuals may experience only a mild cough and fatigue, while others may succumb to the full fury of the disease. The most common symptoms of COVID-19 resemble those of the common cold or flu, including fever, cough, shortness of breath, fatigue, muscle aches, headache, loss of taste or smell, sore throat and congestion. These symptoms typically appear 2 to 14 days after exposure to the virus. In more severe cases, COVID-19 can lead to serious complications, such as pneumonia, acute respiratory distress syndrome, sepsis, multi-organ failure, and even death. These complications are more likely to occur in individuals with underlying health conditions such as heart disease, lung disease, diabetes, or a weakened immune system. Understanding the spectrum of COVID-19 symptoms and potential complications is crucial for both individuals and healthcare providers. Early recognition of severe symptoms can prompt timely medical intervention, potentially improving outcomes and saving lives. Section 5. COVID-19 versus the flu: a tale of two viruses. The COVID-19 pandemic has often been compared to seasonal influenza, but while both are respiratory illnesses, they are distinct entities with important differences. Understanding these distinctions is crucial for informing public health measures and individual behavior. Both SARS-CoV-2, the virus responsible for COVID-19, and influenza viruses spread through respiratory droplets. But COVID-19 is significantly more contagious. This increased transmissibility is due in part to the ability of SARS-CoV-2 to spread asymptomatically, meaning individuals can transmit the virus even without showing symptoms. Furthermore, COVID-19 has a higher mortality rate than seasonal influenza. While the exact mortality rate of COVID-19 is still being studied, it is estimated to be significantly higher than the 0.1% mortality rate typically associated with seasonal flu. Additionally, COVID-19 can lead to a wider range of complications, including long-term health effects such as long COVID, a condition characterized by persistent symptoms long after the initial infection has cleared. These long-term effects are not typically observed with seasonal influenza. Action 6. Our greatest weapon, the power of individual action. In the face of a global pandemic, it's easy to feel powerless, like mere specks of dust in the vastness of the cosmos. However, the truth is, each and every one of us possesses the power to make a difference. Our individual actions, however small they may seem, can have a ripple effect, ultimately influencing the course of this pandemic. Hand washing, a simple act we often take for granted, becomes a powerful weapon against the invisible enemy. The mechanical action of scrubbing, combined with the chemical properties of soap, effectively dismantles the virus's protective envelope, rendering it inactive. Social distancing, while challenging our innate human desire for connection, is another crucial tool in our arsenal. By maintaining physical distance from others, we limit the virus's opportunities to spread, effectively slowing down the chain of transmission. Staying home when sick, wearing a mask in public, and getting vaccinated are not merely recommendations, they are acts of collective responsibility. By adhering to these public health measures, we protect ourselves, our loved ones, and the most vulnerable members of our community. Section 7. A beacon of hope, the path forward. The COVID-19 pandemic has been a time of unprecedented challenges, testing the limits of our healthcare systems, our economies, and our collective resilience. Yet, even in the darkest of times, the human spirit, driven by an unyielding thirst for knowledge and a profound capacity for compassion, continues to shine through. Across the globe, researchers are working tirelessly to understand this novel virus, developing innovative treatments and vaccines at an unprecedented pace. Their dedication and ingenuity give us hope that we will one day overcome this challenge. The path forward lies in embracing the principles of science, collaboration, and empathy. By trusting in scientific evidence, working together across borders and disciplines, and showing compassion for those affected by this pandemic, we can navigate the challenges ahead and emerge stronger on the other side. The COVID-19 pandemic has been a stark reminder of our interconnectedness, demonstrating that the health of one is inextricably linked to the health of all. As we move forward, let us carry with us the lessons learned, embracing a future where science, compassion, and collective action guide our path.